In early 2021, I met a lovely elderly woman in her 90s. She was brought to a community center in a predominantly African American community in Las Vegas. I will call her Mildred. I was there in my role as a public health pharmacist providing COVID-19 operations and vaccinations. I saw Ms. Mildred standing in line, waiting patiently with her granddaughter, who had brought her to the appointment that day and had made the appointment for her online. I noticed a look of apprehension on her face, kept checking back in with them, looking over to see how they were doing. Eventually, I decided to go over and talk to them. I walked over, introduced myself, said, "Hi, my name's Dr. Madison. I'm helping with the vaccines today. Can I answer any questions for you?" Her granddaughter said, "No, I think we're doing okay." But I still got this sense that Ms. Mildred was very nervous about getting her vaccine. So I asked, "Are you nervous about getting your vaccination today?" She said, "A little." I said, "Would you like for me to give you the vaccination?" She said, "Can you?" She looked over at her granddaughter, and then she looked back at me and said, "Yes." During this time, it was at the height of the COVID-19 vaccine rollout, when we were feverishly trying to get the most vulnerable in our population vaccinated with limited supply, and many had to wait hours to get their vaccination. I waited for Ms. Mildred and her granddaughter to get to the front of the line, and I brought them over to my vaccination station. And when we were all done, she said, "I didn't even feel the needle. Is that it?" I said, "Oh yes, Ms. Mildred, I definitely gave you the vaccine." It made me feel so happy that she had had such a positive experience, especially with her initial apprehension. I walked them over to the observation area, let Ms. Mildred sit down, and she looked up at me and said, "Thank you. Thank you. Thank you." She told me she was so happy to see another Black person there helping to run the clinic and providing vaccinations. You see, even though this was in a predominantly African American community, I was the only one that looked like her providing the vaccines that day. So right before they were about to leave, I decided I would check back with them one last time. So I walked over and I said, "Ms. Mildred, how you feeling? You have any other questions? How you doing?" And she looked at me and she said, "Honey, I'm going to tell all my friends how easy that was." As a public health advocate, that was music to my ears because I knew that she was going to go and tell all of her friends how easy this was. And what does that mean? That means that she was going to be the messenger that they needed so that they could make the best decision for their health care. I have no idea how many people Ms. Mildred told, and I have no idea how many lives she may have saved because she spoke about her lived experience. I knew that the right message getting out was important. As a woman of color, I know how important representation is. But what I didn't know was how important having the right messenger was when communicating health information to vulnerable populations that needed to trust the message. Because we know people don't just take the information and understand it. It's about who's delivering the information, not just the information itself. We know that public health is part of how we make this connection. Because when we have trusted messengers, the information can be heard, understood, and drive action to change, not just for them, but for their families and their communities. This is the premise behind public health and why we need to invest in public health infrastructure and the public health workforce. So why does the messenger matter so much? Shouldn't the facts be enough? Have you ever Googled your symptoms when you got sick? Ended up on a WebMD article or a health-related blog? Weren't you more likely to take that recommendation if it came from somebody who looked like you, someone who sounded like you, someone who you trusted? You're not alone. We've all done this. As early as 2005, the Journal of American Medical Association published a study looking at the impact of the internet on how we consume health information. It showed a huge shift in how people were accessing medical information and that they were more likely to go to the internet first before seeking the advice of their healthcare professional. A more recent study published in the journal Vaccines in December 2021 showed that people were more likely to take COVID-19 vaccine recommendations from a family member or friend, from somebody who'd personally been vaccinated, or from a trusted healthcare professional. I saw this firsthand when I started going in the media talking about public health and vaccines. One of the things I'm most grateful for in my professional career is my involvement in national and local media. You would never in a million years have told me as a clinical pharmacist that I would have needed to have a media bag in my car at all times so that I could be camera ready for the most latest breaking health news. I've been featured in over 200 on-air media appearances for my health and medical expertise. And I know it's made a difference because I had countless family members and friends come to me and tell me that one of the reasons why they got vaccinated was because they saw me in the news. In addition to somebody looking like you, it's also incredibly important that they sound like you. Let me give you an example. Several years ago, I was involved in an initiative called Hep B Free Las Vegas. The goal of this program was to educate the Asian and Pacific Islander community about hepatitis B virus, provide them with counseling, testing, and vaccination. In my role as a faculty member, I had access to allied health professional students who knew languages such as Vietnamese, Mandarin Chinese, Tagalog, and Thai, just to name a few, and could help with translation services. The other thing that was so great about this intervention was that we were able to provide these clinical services at a Buddhist temple, which was already a trusted and reliable community resource. It made such a difference when we were able to provide the information from someone who looked and sounded like them, but also who knew their culture and their history. So what can you do? We need you to be the messenger. If we know someone who needs to make a health-related decision, help them get in touch with somebody that they can trust and rely on. We need to advocate for more diverse healthcare professionals that are more reflective of the communities that they serve. If you are someone who needs translation services, you need to get access. So request in-language services if you are a non-native English speaker or if you're accompanying a non-native English speaker. These simple changes can make all the difference because we know when we prioritize trusted messengers, it can literally save lives. We saw it firsthand during the pandemic. So we need you to be the messenger. The data is clear. Your family and friends, they're looking to you to help them to make these important decisions. We know that it's not just going to impact those closest to you, but create a ripple effect that's going to impact the entire community. This is the premise behind public health. Because remember, when we help one, we can help many. Thank you.